Today, we'll be discussing cervical cancer among women and HPV.
Cervical cancer refers to abnormal growth of cells on the cervix of the woman.
Wow. We normally hear cervical cancer, but most of us don't know what it truly is. And so now that you're here, we would like you to take us through what you think cervical cancer is.
Okay. So cervical cancer refers to cancer of the cervix. So
Okay.
I will define what cancer is, and I will tell you what the cervix is. Okay. So cancer refers to the abnormal growth of tissues. Sorry, the abnormal growth of cells
Okay.
on a part of the body. So ordinarily, the human body is made up of cells, and the cells function to make sure that we go about our daily activities.
Okay.
And the cells are programmed. What it means is that there's a time for a cell to come,
Okay.
do whatever it's supposed to do. So if it's cells of the eye, it's supposed to let you see. So it will do what it's supposed to do. And when it's time for that particular cell to die, for more cells to come, it will die.
Okay.
However, the cells can go a bit haywire, such that when it's supposed to grow, the growth of a cell is in a controlled manner.
Okay.
However, when cancer occurs in a particular cell of the body, the growth is not controlled.
Okay.
So when the body tells the cell to stop growing, it does not obey that command, and it keeps growing out of control. So cancer refers to the abnormal growth of cells in the tissue of the body.
Okay.
And your cervix is the neck, let me use that word, the neck of your reproductive organ.
Okay.
So we all know that when a woman is pregnant, the baby stays in the uterus, which is the womb, right?
Yeah.
Now, the cervix is a connection between the uterus, which is the womb, and then the vagina.
Okay.
So when a woman is pregnant, the baby is in the uterus, and the cervix is an opening at the tip of the uterus.
Is that what we also call the vagina opening?
No. So
Okay.
the vaginal opening is different.
Okay.
So when the baby is in the uterus, right, there's an opening that is at the tip of the uterus, and that is the cervix. So I don't know if you've heard this, but when women are pregnant and they are in labor, you usually hear 2 centimeters dilated.
Yes, and then you have to wait for it
For it to be 10 centimeters before you can give birth to a child. So what is dilating? And dilating means opening up.
Yeah.
So what is opening up is the cervix.
Okay.
Do you get it?
Yes,
So the cervix
yes,
is like a connection between your uterus and then your vagina.
Right.
So cervical cancer refers to abnormal growth of cells on the cervix of the woman.
Wow.
basically what cervical
Basically
cancer
that.
is.
Now, this cervical cancer, what causes it though?
Okay. So cervical
You made
cancer-
mention about the, abnormal growth of the
Yes,
cells.
yes.
So what actually causes
the
yeah.
abnormal growth of the
Yeah.
cells. So cervical cancer, the main cause of cervical cancer is the HPV virus.
Ooh.
Yes. So the
okay.
HPV virus stands for human papilloma virus. Yes.
Okay.
And we all know what a virus is, right? So the HPV virus is sexually transmitted. Exactly. So when
So is it a type of STI?
yeah.
It can be.
Yeah, of
Okay.
course, yeah. So when a person has the HPV virus and they engage in sexual intercourse with someone who does not have the HPV virus, they can transmit the HPV virus to the person. Now, the HPV virus, because it is sexually transmitted, is very common.
Okay.
Research has shown that about 80% of sexually active adults have the HPV virus. Now, in a healthy person, right, you may have the HPV virus and then you'll be fine.
Because it won't show.
It won't show.
Okay.
You have the HPV virus, you'll be fine. You'll be going about your normal activities. And if you are very healthy, your body can actually fight the virus and then you'll be okay.
Okay, so unlike the HIV that it might not show from early stages and you might still need serious medication,
Yeah.
HPV, your body can...
Exactly.
Okay.
Your body can fight it.
Okay.
Exactly.
Okay.
That is in a healthy person who eats well, exercises and all that. Yes. The HPV virus in a healthy person can be fought by the body.
Okay.
Can be cleared from the system. However, when you are not too healthy and you don't engage in healthy habits, so you smoke, you don't eat right, you don't exercise, or you have another infection or another condition that puts you in an immunocompromised position. So you already have HIV, you have something like diabetes, an infection or a disease that is already existing in your body. When you have the HPV virus as a superimposed infection, your body may not be able to fight it like in a healthy person.
About the body fighting diseases, does it have anything to do with blood groups?
Not necessarily. No.
Oh,
Yes.
okay.
Yeah. So
because I hear people saying, "Oh, me, I have a strong blood group." Oh, not.
No.
Okay.
Blood group is a whole different thing altogether. Yes. So the things that fight infections in your body, they are your white blood cells. Yes.
Okay.
And everybody has white blood cells.
Okay.
Yes. So it has nothing to do with blood group at all.
Right.
Yes, please. So as I was saying earlier, in a healthy person, the HPV virus is easily fought off by the body.
Okay.
However, if you have a superimposed, a pre-existing condition, or if you are not too healthy, then the HPV virus will stay in your body. Now, when it stays in your body, what makes cervical cancer very interesting is that the HPV virus can stay in your body and you would not know. And it would stay for a very long time. So some people have the HPV virus for 10 to 20 years.
Wow.
Exactly. And they are living normally. They don't feel anything. They think everything is fine.
Okay.
Now, with time, when the virus stays in your body for a very long time, especially on your cervix as a woman, then it can develop into a cancer.
Oh.
Yes. Okay. So HPV is a virus, right?
Okay.
It doesn't only cause cervical cancer.
Okay.
It causes other things.
Other things.
So it can cause throat cancer.
Okay.
Yes. It can cause anal cancer. It can cause penile cancer. But when you are a woman and you have a cervix, then the HPV virus can lodge on the cells of your cervix and cause cervical cancer over time if it's not treated. If you're not healthy enough for your body to fight it off, it can develop into a cancer.
Wow. You made mention that it's a sexually transmitted infection. That means we only get HPV through sex.
Yes.
Okay. Now, what are some early signs of maybe cervical cancer or HPV? If, since you said it's not too unnoticeable, how would you know? Because the regular, randomly, I know I'm fine, I know I'm healthy.
Yeah.
Why should I go for a check? What are the early signs?
Okay. So cervical cancer is very difficult to work with because of how it presents. So usually, as I mentioned, you may have the HPV virus in your body for a very long time, and it would not develop into cancer.
Okay.
After it has developed into cancer, you may show no sign at all for another maybe 5 to 10 years. When your body starts showing signs, it sometimes means that the disease or the cancer has progressed into the late stages. So some of the signs, and the most common signs, is abnormal vaginal bleeding. Yes. So we all know as women, we bleed every month.
Yeah.
During your menstrual period.
Yeah.
However, if you notice any abnormal bleeding, where abnormal bleeding is bleeding outside your menstrual cycle, your menstrual period, prolonging longer than usual. So your period lasts for 3 to 5 days, right? Okay. And yours is 5 days, but it's been a week, a month, and you're still bleeding. It's a red flag that you should look out for. So abnormal vaginal bleeding. So bleeding outside of your menstrual period, prolonged bleeding, and also bleeding during sex. Okay. Yes. So ideally, you're not supposed to bleed during sex. However, during sex, if you notice that you are bleeding, it could be a red flag or a sign that you should seek for medical help. And so that is for abnormal vaginal bleeding. Another sign is offensive vaginal discharge. Yes. So as I mentioned, as ladies, we all have vaginal discharge during our cycle, especially when you're ovulating. It's normal to have some bit of discharge. This discharge, however, is not supposed to have an offensive smell. So if you notice any discharge from your vagina that has an offensive smell, it's a cause for concern.
Okay.
Note here that it's not every vaginal discharge that means you have cervical cancer. There are so many STIs and vaginal infections. So like candidiasis, vaginal candidiasis, you can have some discharge.
Okay.
Gonorrhea, chlamydia, all those sexually transmitted infections, you can get some discharge. However, cervical cancer can also show as offensive vaginal discharge. So any vaginal discharge you have, it's best you go to a doctor or a hospital near you just to check. It could be a simple STI, which will be cleared by some antibiotics. Yes, but you just have to be safe to make sure that it is nothing dangerous
that would harm you. Yes. True. You made mention a few things related to women.
Okay.
The men, what are some of the things that would make them rethink or know that there's something called HPV? Some of the signs on the
men.
Men.
So as I said, HPV is a virus. It causes so many other things apart from cervical cancer, and I mentioned some of them, right? Yeah. So for men, they don't have a cervix, so they will not get cervical cancer when they get the HPV virus. But what they can get is some genital warts. So if you are a gentleman and you notice that you have some growths, okay, or some bumps in your nether regions, could be itchy, painful, have discharge as well. It could be a sign that you have an infection. It could be any other STI. It could also be HPV. So get it checked. Okay. And as I mentioned, it could cause penile cancer, anal cancer as well. So anything or any occurrence in your genital area that you know is out of the ordinary, it's best to go to the hospital to get it checked.
Oh, we have some delicious drink coming in from 1025 Cafe. That's so delicious, guys. Do well to visit 1025 Cafe, not far from the Wayek Grove, and sort yourself out. How does it feel?
It's really good. Very refreshing.
Right.
Really like it.
Right. Remember, this show is proudly brought to you by 1025 Cafe, Relief Kids Bike Park, Every Lady's Comfort, Mandem Special Drinks, and Heby's Kitchen.
So another thing that you should look out for is, so I mentioned bleeding during sex. Another thing is pain during sex. Ooh. So ideally, you are not supposed to have pain during sex. But
I thought frictions and other things also cause pain. So.
Well, yes, but I'm talking about like pain. Yeah, you know, this is very painful. Exactly.
Okay.
So if you're experiencing a lot of pain during sex, I think it means you should get checked just in case, you know, it's cervical cancer.
Okay.
So I mentioned abnormal vaginal bleeding, bleeding during sex, and then painful sex. So, and an offensive vaginal discharge as well. So those are the main symptoms that will tell you something is wrong and you need to get checked. But of course, as I mentioned, if you get these symptoms, means you are getting to the late stages of the disease. You know, you are going toward the late stages. So it's best to get checked even before these symptoms set in.
So early detection.
Early detection is very important in cervical cancer.
Right. Yeah. So I want to find out, cervical cancer, can it be prevented? Yeah. You know, there are people, I don't know, but I'm sure there are people out there who have never even experienced this before. Yeah. Maybe not because they are not taking proper care of themselves, but because maybe they are living a particular lifestyle that is helping them, you know, prevent. Is it preventive?
Yeah, very, very preventable.
Okay.
Yes. And as I mentioned, HPV is sexually transmitted, right? So primary prevention, abstinence is the best.
Okay.
But if you cannot abstain, of course, you need to use protection. So a condom during sexual intercourse will prevent you from even getting the HPV virus in the first place.
Okay. So about cervical screening, is it so important? Because for someone like me who haven't experienced any symptoms, what would trigger me to want to screen?
Okay.
And why is it important?
Okay. All right. So in health in general, right?
Okay.
We always advocate for prevention, making sure that a particular disease condition doesn't set in before you go about seeking help.
Okay.
That's why doctors always encourage regular health checkups.
Right.
You'll be feeling fine, you may have no issues. I just walk into a health facility, get tested, get everything checked, just to make sure that your body is functioning normally. So the best thing you can do for yourself is to add cervical cancer screening to your annual health checks. Okay. So cervical cancer has a lot of screening methods. One of the most common is called a pap smear.
Okay.
Yes. So basically what a pap smear is all about is that they take a swab or a sample from your cervix.
Okay.
And then they look at the cells of your cervix under a microscope.
Okay.
To visualize the cells to make sure they look normal.
Okay.
So that is the pap smear. It is not painful. It may be uncomfortable because it would involve they accessing your cervix.
Okay.
But it's nothing painful. Exactly. So that is for the pap smear, taking a sample from your cervix to visualize the cells under microscope to make sure they are okay. And the second screening method is called the HPV screening test. So the HPV screening test is less invasive, depending on the method being used than the pap smear. So there are HPV screenings, which also involves taking samples from your cervix and then testing to see if they can visualize the HPV virus DNA.
Okay.
So if they see the virus, the DNA of the virus, then they know that you have the HPV virus.
Okay.
But it hasn't progressed to cancer yet. So with that, there are medications that you can be given to clear the HPV from your system.
Are they vaccines?
Yes, there are vaccines as well.
Okay.
And before I come to the vaccines, so as I mentioned, one of the ways of screening for the HPV virus is they taking a swab from your cervix, which is a bit more invasive.
Yeah.
But there are newer tests that you can even do
More
at home.
comfortable.
Yeah, more comfortable, accessible tests, like the HPV urine test. So it's like it's like a pregnancy test. You urinate on it, and then give it some time, you check if it's positive, then you have the HPV virus.
Oh, okay.
It may not have progressed to a cancer yet, but you have the virus. You can just go to the hospital, they'll give you medications to clear the HPV virus from your system.
Wow.
Another way of combating this is also to go for the vaccine,
Okay.
which ideally works best. The word here is best.
Okay.
In people who are not sexually active. That doesn't mean it's for them only. So in foreign countries, right, there usually is a routine thing for adolescent girls and even boys between the ages of 9 and 14 to get the HPV vaccine. Because you may think that children around that age, they will be abstaining and everything, but they want to, how do I say? They want to prevent their children from getting the virus at all. So they vaccinate them as early as 9 years old.
Wow.
So that if they want to engage in sexual activities, unfortunately, at that young age, at least they know they are protected. So
how about old age?
Old age, yes. So for old age, as I mentioned, the vaccine helps when you are not sexually active. But if you are sexually active, you can still go for the vaccine. It has some effect, although it's not as effective as
when you
So old age, the best thing for you at your old age is the pap smear.
Okay.
And then the HPV. So if you are not sexually active, the best thing to get is the vaccine.
Okay.
But if you are sexually active, the best thing to do is to get the pap smear and to get your HPV testing. Yes. And the good news is that the Ministry of Health just implemented the HPV vaccine. Yes, it happened this year, and I was so happy when I heard it. So now, children between the ages of 9 and 14, girls for now, can get vaccinated for free, actually, yes, with the HPV vaccine. So if you are a lady, a mother, a father, and you have an adolescent girl between the ages of 9 and 14, just walk into any health facility requesting for the HPV vaccine, and then your child will get vaccinated.
Right.
For free, actually.
Ooh, thank you. That's some
Yeah.
good news
Yes,
there.
yes.
Okay, Dr. Kelyne, where can people access this vaccine and the screening?
Okay. The HPV vaccine is available in any health facility.
Okay.
So Kolebu, Achimota 37, any health facility near you, just walk into their reproductive health unit and ask for the HPV vaccine. And then if your child is between 9 to 14, it's completely free. It's paid for by the government. As if you are not within this age bracket, then you would have to pay for that. You need 3 vaccines to be fully immunized. So you go for your first shot. They will tell you when to come for the next one, then the next one, then you are immunized for a very long time. Now for the screening, okay, you can walk into any health facility and request for a pap smear or an HPV screening. So it's best if you get both of them. So you first of all check if you have the HPV virus via the HPV screening test, and then you do your pap smear as well. So if you do this, you don't have to get checked for the next 5 years. And you can follow our foundation, that is Cervical Foundation Ghana page on Instagram, LinkedIn, Facebook, and Twitter. We keep you updated on everything cervical cancer. Any question you might have on cervical cancer, just follow our pages and we'll give you the information. I think there's a post that we actually made outlining all the health facilities where you can get HPV screenings done across the country. And we organize it by regions as well. So Greater Accra region, we have all the hospitals where you can access this, Ashanti and all the regions in Ghana. So just follow the Cervical Foundation Ghana page for any information on cervical cancer.
Wow, that's a very good job you're doing. And so I will encourage you all to take advantage of this vaccine and make sure your ward gets it. Well, Dr. Kelyne, there's a little concern.
Okay.
You know, young ladies now, I don't know if it's society, but they have various means of treating themselves at home.
Okay.
So self-treatment.
Okay.
With this offensive discharge and all that you mentioned, there are people that the moment they see that, their go-to is to find, they source for their own remedies.
Yeah.
So they end up putting things, like foreign things into their genitalia.
Okay.
Can these things generate into cervical cancer?
Okay, that's a very good question. Self-medication is never the answer.
Okay.
It doesn't matter whether it's malaria, it's typhoid, any condition at all. If you have any symptom that is bothering you, just go to the nearest hospital. Because the thing with medicine is that one symptom can represent a lot of diseases. So someone might have a headache. It could be a regular headache that can be treated with paracetamol. But that same headache could be due to a brain tumor. But it's just a headache. Okay. So when you have something that is bothering you for a long time, maybe if it's pain, you've taken some painkillers, but it's still persisting, the best thing to do is to go to a hospital to be seen by a doctor, go to the right channels to be tested for whatever is wrong with it to be diagnosed, then you'd be giving the right medication. Now with ladies, right, anything that is wrong with your genital area, I know because of our Ghanaian culture, talking about reproductive health issues, it's a little bit, we are still getting used to talking about it freely. So a lot of girls tend to get shy and decide to self-medicate. I would not encourage you do that.
Okay.
If anything is wrong with your genitalia, just go to the hospital, get it checked, and be given the proper medication. However, these foreign things that ladies put in their genital area do not necessarily cause cancer.
Okay.
But it can give them other problems in future. Yes. So the best thing is just to go to the hospital to get checked. Although it may not give you cancer, it may give you other problems.
Wow. Wow. We've really learned a lot today. We've really gone through, I believe, all the unquestionable questions here on the Pluspod Show. Dr. Kelyne, we would want to know, what are some advice you would give to, young, adults or young people who are sexually active?
Okay.
That is my problem. Who are sexually active, because there are people that, they don't even have time for early detect going for a screen or something because they feel, oh, I'm healthy and all. What advice do you have for them?
What I would like to tell the youth is that cervical cancer is real. It's the 4th most common cancer globally. And in Ghana, it's the 2nd most common cancer that kills a lot of women, thousands of women in Ghana every year. So it is very real. And as I mentioned earlier, the HPV virus, which causes cervical cancer, is sexually transmitted. So if you cannot abstain and you are sexually active, the best thing you can do is to protect yourself. So make sure you use a condom during any sexual activity, even if you have a partner, because you might think you have just one partner and you are faithful. You may not know the activities of the other person. So just protect yourself and use a condom during sexual intercourse. Go for your pap smears. So the good thing about pap smears is that it's done every 5 years. So you do a pap smear, you may not have to do one again till the next 5 years. So it's not something regular that will be a bother to you. Just do one every 5 years to make sure your cervix is okay. Get the HPV screening. If you have the HPV virus, go to the hospital to get medications to treat the virus before it progresses to become a cancer. Yes, cervical cancer is real, but it's very preventable.
Right. So viewers, you heard it all from Dr. Kelyne. Cervical cancer is real. And right now, as young adults, it is more salient and vital to consider our health over any other thing. And so early detection, personally, I don't think it's too expensive. You can't, afford. And your health is very important. I think must be served with much, much more priority. Can you please let us know your social media handles? If someone wants to test you privately, so that's fine for you.
Okay. So my handle is Dr. Kelyne on all platforms. So Instagram, LinkedIn, anywhere, just Dr. Kelyne, Kelyne. You will find me. You can also follow our official page, Cervical Foundation Ghana. And then you can text us. We'll give you all the information you need.
Right. Okay. Thank you very much, Dr. Kelyne, for coming to the Pluspod Show. It's an honor. We were really impacted, and then we hope to have more conversations with you on our health issues. And so it's a wrap today on today's episode on the Pluspod Show. I believe you were inspired, you were educated, and impacted. Remember to follow us on all social media platforms at the Pluspod Show and subscribe to our YouTube channel, the Pluspod Show. Do well to leave your comments at the comment section and ask us about any, confusion you have or any controversies. We are here to answer it all for you. As well, do well to like and share this video. This show is proudly brought to you by 1025 Cafe, Relief Kits by Clark and Ladies Comfort, Mandem Special Drinks, Coffee Q Studios, and Heavy's Kitchen. See you same time next week. Until then, it's a bye.